Good morning, everyone. Thank you for joining our employee behavioral webinar this morning. I'm Kyle Monroe, Vice President of Network Development and Provider Relations here at the Alliance. Before I begin, please know you are all in mute mode. If you have any questions during the webinar, send them in the chat box. If you want to say something during the webinar, please raise your hand by clicking the icon so the green arrow points up. Also, big thanks to those who submitted questions prior to today's webinar. And please remember to download today's event resources by using the control panel before you leave. The past years brought us new sets of challenges for individuals and families around the world. Mental and behavioral health and wellness are at or near the top of the list of challenges exacerbated by the pandemic. Employers have an important role to play in the well-being of their workforce. More specifically, employers directly impact the mental and physical well-being of employees on a daily basis, positive or negative. We're lucky this morning to have an expert with us who happens to be an expert in this space. Dr. Jerry Halverson is a board-certified adult psychiatrist with subspecialty in consult liaison psychiatry. He's advocated for the use of objective data to improve patient care through his work at Rogers and others such as the American Psychiatric Association and the American Medical Association. Dr. Halverson will discuss how employers can handle workplace anxiety during these unprecedented times. In addition to Dr. Halverson, we'll be joined this morning by Julie Norland from MRA, as well as Diana Clark from Promega. Julie and Diana will share some of their recommendations on how to help employees with their behavioral health during the COVID-19, as well as how to provide a positive work environment for employees and their families. Before I turn it over to Dr. Halverson, I thought I'd mention a few things that we're doing at the Alliance to help address the mental and behavioral needs of your employees. Access to mental and behavioral health services can be challenging, as we know, particularly in Wisconsin. Since the beginning of 2020, we at the Alliance have added over 110 behavioral health practices to our network. These practices include over 850 individual clinicians that are now available to Alliance employers, employees, and their families. We've also partnered with two new telepsych companies, .com Therapy and CareClicks. These organizations are now available to you as well as part of and integrated with the Alliance network. We're always working on your behalf and on behalf of your employees to find new solutions to meet your evolving needs. If you have more specific questions, don't hesitate to reach out to your member services representative, to Melina or to myself. I just want to say thank you again for spending time with us this morning on such an important topic. So without further ado, I'll hand it off to Dr. Halverson.
Thank you, Kyle. It's my pleasure to be here. Let me see if I can figure out how to show the correct screen here, and we can get going. I think that's the one that I want to show. And I am assuming that I am showing the right screen right now. You should have my screen with the title page on there. I'm here to talk about a really important topic, employee mental health in a pandemic. Obviously not a topic that I would have told you over a year ago that I'd be here talking to you about, but it's important. It really has put mental health as well as other levels of employee health really in the fore. Just so you have a sense of where I'm coming from, the Chief Medical Officer at Rogers Behavioral Health.
I'm sorry,
yes.
You can see both screens right now. Can you just move the one to the left out of the way?
Sure, let me see if I can figure out how to best accomplish that. How about that?
Yes, perfect, thank you.
All right, excellent. So just to give you a sense of where I'm coming from, I'm from Rogers Behavioral Health. We are the nation's largest private not-for-profit behavioral health system. We're out of Oconomowoc, Wisconsin. We've been here for over 100 years. Just so you have a sense of the scope and the size and where we're at, there's a pretty map up there. We employ over 2,500 of your fellow Wisconsinites, 180 plus medical staff, and over 100 are psychiatrists. And we treat pretty much everything, and we're pretty busy. Okay, today's agenda. Really, what we're looking at today is why mental health matters and the economic impact of it, the effect of COVID on mental health, and the most common conditions in the workplace and how to recognize them, and then what employers can do. Finally, we'll get into what employers can do to help maintain a healthy workplace and make sure that there's productivity, there's retention, and engagement, because all of these certainly can affect that. So again, why does this matter? If you take a look at the Mental Health America report, Mind the Workplace, it tells us that mental health workplace is costs. I'm sorry. Let me just move this so that I can see this a little bit better here. I'm sorry. Mental Health America reminds us that that's the problem that we had before. Interesting. All right. This is, just give me a second here. Okay. Mental Health America reminds us that in their Mind the Workplace, that I'm going to just move. I have usually having two screens is awesome. And at this point, it's a little bit more annoying than awesome. Okay. Per Mental Health America's report, Mind the Workplace, workplace mental health issues cost companies over $500 billion in lost productivity a year. It's a major cause of disability, absenteeism, presenteeism, and productivity loss for adults in their prime working years. And just a kind of a couple definitions. Absenteeism is people that don't show up to work. Presenteeism is people that do show up to work, but they might as well not have showed up to work. They're not engaged, they're not able to do the work that they need to do. 1 in 5 people we know experience mental illness in a year. And many who need the help don't seek it out, despite the fact that we know that treatment is effective. And the impact on health with increased incidence of heart disease, stroke, diabetes, and certain types of cancer is very clear. So again, more workers are absent from work because of stress and anxiety than because of physical illness or injury. More days of work and work impairment lost by mental illness exist than many other chronic illnesses that we talk about more frequently, such as diabetes, asthma, and arthritis. And employees with depression report productivity levels at around 70% of their peak performance. So even people that have depression that are able to get to work are not able to perform to the level that they're normally able to. And depression itself is estimated to cause at least 400 million lost work days a year. In a 3-month period, employees with depression miss an average of 4.8 work days, have 11.5 days of reduced productivity.
Dr. Halverson, forgive us for interrupting you again. We cannot see the presentation. It is
okay.
Why this matters, and it's not in a presentation format. It's
okay.
just yeah, sorry to bother you.
No, I appreciate knowing what people could see. I think I keep getting this. And then are you still seeing the presenter mode?
So if you go into display settings, up at the top in the ribbon there, yep. And then I think it's that. Yep, there you go.
Okay, so we're good now?
Yes,
I apologize. I apologize. Again, we have the psychiatric disorders, but beneath psychiatric disorders are oftentimes medical disorders, substance abuse disorders, which we'll talk about, and again, the pharmacy benefit are things that you can see, but what you're also seeing is disability, presenteeism and lost productivity, absenteeism, unrealized output, stress on other team members that have to make up for that team members, overtime to cover those absences, overstaffing, temporary workers, recruitment, hiring costs, and retraining. All of these are caused because of mental illnesses that aren't being appropriately and adequately treated or addressed. Again, in every given year, we know this is every the likelihood of having mental illness. An estimated 20% of adults in a normal year, let's just say a normal year, not a pandemic, experience mental illness. At least 10% of adults on top of that have a substance use disorder, and at least 5% have had both. So they're very common among employed populations. And now in a pandemic, obviously, we do know that due to the pandemic, even before the pandemic, we were struggling with mental illness and mental illness related access issues. There was a mental health crisis growing in the Metro Milwaukee area, with crisis calls increased even starting in 2019, which is obviously before the pandemic. According to the Kaiser Family Foundation, 53% of adults in July 2020 reported that COVID negatively affected their mental health. 36% had trouble sleeping, 32% had difficulty eating, 12% increased their use of substances, and 12% actually admitted that it worsened psychiatric concerns. And again, we remember July. July seems like such a long time ago, and there's been so much time between now and then living with this pandemic. Looking at the impact of COVID-19 per the CDC, symptoms of anxiety disorder and depressive disorder increased considerably in the United States during that time, April and June, which again is early in the pandemic, compared to the same period in 2019. Taking a look at 31% of adults reported struggling with anxiety or depression symptoms. Almost more than 10% started using substances, trauma-related issues, and actually looking at this, 11% seriously considered suicide, which is obviously very, very concerning. I'm going to talk a couple times here. I'm going to show what the CDC looked at. The CDC kind of identified this as an issue, and they started sending out a pulse survey, a brief survey to different households to try to rapidly respond to the mental health aspects of the pandemic and to provide relevant data. They sent out a depression screener and an anxiety screener. Those are the PHQ-9 and the GAD-2. And they looked at it in 3 phases: April to July, August to October, and October to December. They also went into this year a little bit, and we'll talk about that at the end as to where we're at right now. So since COVID, the CDC's Household Pulse Survey suggests that the proportion of adults with anxiety or depression has quadrupled with COVID, and the burden disproportionately has been borne by women and by people of color, and I'll show you those numbers in just a minute. The Pulse Survey also suggested that access to care in the U.S. worsened, evidenced by nearly 1/4 of adults in early November reporting that they have not received needed care. Now, obviously, there are other reasons other than access for people not getting the care that they need, such as being afraid to go to the hospital because of COVID. There are, but certainly access has decreased, and we'll talk a little bit about that coming up. So taking a look at, I just chose April of last year because that's, again, kind of right around where we're at. These are all symptoms of depression and anxiety, and this is the CDC Pulse Survey. If you want to take a look at the numbers that are in front of you, 36% of all Americans were having symptoms of anxiety and depressive disorder at this time last year in the pandemic. And obviously that is higher than what we would normally see. But I want to target a couple of things I want you to look at. 18 to 29-year-olds, almost 50% are struggling with some symptoms of depression or anxiety, as well as you take a look at non-white ethnic groups at a higher rate than the white race, which I think is pretty important. Taking a look at another time in the middle of the pandemic, just so you can kind of track this, looking at the end of December, where the struggle is higher. But take a look at our 18 to 29-year-olds. Again, this is really key time for productivity and work. Over 50% were dealing with symptoms of depression and anxiety in the middle of this. And again, you can compare the non-Hispanic whites and the non-white groups, and you'll find again that they've disproportionately borne these increases. So it's out there. This COVID has affected the health, safety, and well-being of individuals and communities for obvious reasons. Individuals, there's insecurity, there's confusion, there's isolation, which has been a part of our reaction to or dealing with COVID, and then there's been a stigma continued of attempting to get treatment. Communities have had economic loss, work at school closures, inadequate resources for medical response, and the distribution of necessities has been deficient. As far as treatment access for psychiatric treatment, if you are willing to even get treatment, which is something that we have to work on, some psychiatric treatment actually closed. I know in our community we had less access to some of our community providers. Some patients also put off needed care out of fear. You know, a lot of psychiatric treatment is in groups. I think people really were concerned about going to an in-person group setting in the time of COVID. Telemedicine has been a lifesaver for a lot of people. Some types of treatment improved. The technology was challenging for some providers, which caused them to not have access available. Some patients did not want to do telemedicine, and it's not a great choice for every disorder. We found in particular our substance abuse groups did not seem to do as well with virtual treatment as they did with in-person treatment. Our patients also had trouble getting to pharmacies, let alone the loss of jobs, insurance, access. And again, there are specific concerns with specific treatments and modalities that either got worse or got better. So what changed at the workplace? As you guys know, there were a lot of changes at the workplace. There are still a lot of changes at the workplace. There was this confusion. Are you closed? Are you not closed? Are we essential? Are we not essential? Once you return, have you returned in person or are you staying virtual? And how is that choice made? That's obviously been, you guys have been making those choices. They're obviously difficult choices. There have been places that have been faced with decreased demand that has led to layoffs, decreased workload. Again, with if you have a peer that gets COVID and is out for 14 days, you know, your work is going up. Trying to figure out the social distancing, the masking, the hand washing has been a challenge, let alone the conflict over COVID. We don't seem to have a shared set of facts or a shared belief system over the severity of COVID, and I'm sure that has caused some issues in the workplace. Obviously, patients people are more anxious with COVID. Again, for all of these questions that we've talked about, am I going to go to work? Am I going to get sick? Am I going to get my family sick by going to work? All of those concerns, let alone many businesses just have not been able to function at full capacity or some at all, which has obviously caused its own cascade of problems. So looking at COVID-19 in the workplace, a substantial proportion of the employees in the workplace, per the Kaiser Family Foundation, reported increases in depression and anxiety, which makes sense because we're seeing that in our community. Whether they are essential or not, they're both having anxiety and depression, although essential workers, which were defined earlier in the pandemic, seemed to have higher levels of anxiety and substance use, as well as higher rates of suicidal thoughts. So let's go back to how, as an employer, you might be able to identify and help your employees that have depression, anxiety, and substance abuse, because these were present in the workplace before, and as we've seen during COVID, things have gotten much worse. So they're probably even more present in your workplace at this time. Depression, as we've talked about, is the most common cause of illness and the most common cause of hospitalization for all people in the US under the age of 45. More than 17 million US adults had at least one major depressive episode in the past year. So, I mean, I could have given you this talk before COVID and would have told you that it's a problem, but during the time of COVID, it's an even more significant problem. These mood disorders, depression, bipolar disorder, other mood disorders, are the leading cause of disability worldwide for both men and women. Depression presents at work with withdrawal from your team, increased isolation, maybe some indifference, putting things off, missed deadlines, getting into accidents. Now, again, this is a change. We all have employees that procrastinate, that put things off, that miss deadlines. If that's part of their personality, that's not what we're talking about. We're talking about changes. Seeming scattered or absent-minded, slowed productivity, late to work, afternoon fatigue, unsure of abilities, lack of confidence, low motivation, feeling detached from the environment, from the team, from the workplace, inappropriate reactions, strained relationships, and sometimes changed appearances. Oftentimes with depression, you can have a loss of weight because of lack of appetite. You can have lack of sleep. All of those could change people's appearances. I have to talk about suicide. Suicide is the most common and most concerning outcome when depression goes terribly wrong. It's the 8th leading cause of death. Now, if you take a look at the numbers that we've received out of the CDC over the past couple of weeks, it seems that possibly suicide has gone down overall in the United States. That certainly hasn't been our experience here. We have certainly seen higher levels of suicide attempts coming into our hospital, higher levels of dangerousness, frankly. And looking at the numbers, there are regional differences in suicide rates, as well as differences, ethnic differences, as far as races and suicide rates. So suicide continues to be a very significant issue for us to worry about and to be continued concerned about. More years of life are lost to suicide than any other single cause other than heart disease and cancer. And meaning years of life, oftentimes if people kill themselves, obviously when they're young and in their productive years, you're having a lot of years lost of life. 30,000 Americans die of suicide each year. Over 500,000 attempt suicide each year. And 8 out of 10 people, though, why I bring this up and why it's important to bring this up, 8 out of 10 people considering suicide give some sign of their attention to somebody. And hopefully that's an opportunity for somebody to intervene and get them help. Addiction. We'll also talk about addiction. This is also another common workplace mental illness. Nearly 20 million Americans aged 12 and older battled a substance use disorder in 2017, which is the most recent numbers that I could find. Almost 74% struggled with alcohol. I think since 2017, a higher number of that, there's going to be a higher number of that will be opiates. Than there were in 2017, but this is obviously very common. You have people that have illicit drug problems, you have people that have alcohol problems, and obviously you have people that have both. And of these people, a small percentage of them will also be dealing with depression or anxiety at the same time. Now, depression or anxiety may be driving the severity or the intensity of the addiction. How addiction presents at work: frequently missing days of work, typically without providing any notice, multiple sick days with no doctor's note, disappearing for periods of time and excessive trips to the bathroom, constantly being unprepared, forgetting appointments and missing deadlines, changes in work performance, decrease in quality of work, increase in the time for simple tasks, frequent accidents or injuries, poor memory and ability to focus, conflicts with other employees, erratic or aggressive behavior, poor hygiene, changes in mood and personality, secrecy and isolation, as well as errors in judgment. And then finally, anxiety. Anxiety is the third common mental illness that you will see in the workplace, because they are the most common mental illness in the US. Most of the time, anxiety does not necessarily affect people's ability to work like depression does, but almost 20% of the adult population suffers from an anxiety disorder at any time. Nearly 31% of adults will have an anxiety disorder within their lifetime. And within anxiety disorders, there are different types of anxiety disorders. Generalized anxiety disorder is a disorder where there's anxiety about a lot of different things. Generally, panic attacks, anxiety that really are acute, come and go, and are disabling. Social anxiety disorder, difficulty just operating around other people versus being at home, and post-traumatic stress disorder is something that we're hearing more and more about, and unfortunately appears to be more and more common. How does the anxiety present during work and what might be some of the underlying causes. Again, taking an unusual amount of time off of work, overreacting to situations on the job, focusing too much on the negative aspects of the job, and struggling to concentrate or complete tasks by deadlines. And what are some of the things that you might want to think about that might be in the workplace that might be causing the anxiety? Workplace bullying or conflicts are really important to be able to get on top of and move through. Deadlines, managing staff can be anxiety provoking. Working long hours with a heavy workload, having a low reward, and having a demanding or ineffective boss who's giving a lack of clear direction. There's a perception of being treated unfairly, and there's a loss of control over the work environment. Again, just reading that, you can tell a lot of those things are going on during COVID and can certainly cause higher levels of anxiety. So the problem with all of this is these are common and this is going to happen, but unfortunately many do not get help, which will lead to it sometimes getting better on its own, sometimes getting worse, but really there's this kind of this slow burn where people will generally get worse. 60% of adults with mental illness, with all mental illnesses, didn't receive mental health services in the previous year. Oftentimes they'll suffer for years before getting treated, oftentimes a decade or more, because these disorders tend to recur. Not that they've been depressed for 2 decades, but they have different episodes that they don't get treated. And again, let's just talk about an addiction disorder. If you don't get treated, it will absolutely affect your ability to do your job. You can lose a family, you can lose relationships, and these are the types of casualties that happen in people's lives without treatment. So employees with untreated mental illness who still are going to work still have an illness that impairs them physically, mentally, and emotionally. What are the reasons that people give for not giving treatment? Inability to afford the cost of care is a common. Not knowing where to go for the services. Believing at the time that the problem could be handled without treatment. Feeling that they don't have the time to seek care. Concerned about confidentiality. And many are concerned that it might have a negative effect on their job. Again, with the lack of insight, knowing that their mental illness is having a negative effect on their job when it's untreated. But we do know, I mean, the good news is we do know that treatment works. It's well established that mental health and addiction disorders are treatable conditions. For most disorders, there are a range of treatments that we know work. There are medications. Not everybody needs medications. Not everybody wants medications. Therapies also work very well. Talk therapy, as well as more intensive types of treatment like day treatment or hospitalization or residential treatment are intensive options that can help people that are really struggling. With appropriate diagnosis, treatment, monitoring, over 80% of individuals with depression and anxiety can recover fully. And I think, you know, since I'm in front of you, and I'm going to talk to you a little bit about it, some of our patients are going to need these more intensive options like inpatient, residential, and outpatient. And one of the things that people are worried about is how this is going to affect their ability to work or affect their job. So we'll talk about in a little bit, employers have an important role to play in helping make sure that their employees get the treatment that they need. We do know that with treatment, nearly 86% of employees report improved work performance. 80% of those treated with mental illnesses report high levels of work efficacy and satisfaction. And it also results in a large reduction in people either not showing up or people showing up for work and not being able to do the work that they need to do. So what can employers do to encourage people getting better? Well, obviously employers can encourage treatment or employees to get treatment and make it easy to do so. The first thing to do is to raise awareness, educate employees and managers about mental health conditions, including depression, and encourage employees to seek help when needed. That's really how to do it best, for you not to have to tell them to get treatment. If they feel comfortable identifying and being able to get treatment on their own, then that's really the path that everybody wants to go. There's also a way to integrate mental health information into health communication, including content in community newsletters, on the internet, and other regular employee communication platforms. So the only time to, it shouldn't be the fact that the only time you talk about mental health is talking about it in a negative fashion of how it's making it difficult for people to do this or that. All of us have stories of employees that have had these issues and have successfully overcome them. We also want to help promote early recognition of symptoms so that people can identify their own symptoms and make sure that they can get treatment on their own. What else can you do? You can use your role to promote a healthy culture. You can reduce the stigma surrounding mental health conditions. I was talking about this a little bit before. Mental health continues a taboo topic. So train your supervisors and employees on how to start this conversation if they are concerned about an employee. It should, the C-suite at the top, you should talk about mental health. And that's important. It's important to have everybody in the organization talking about it. Include mental health messages whenever you talk about other types of health, and counter stigma with educational campaigns and anti-stigma initiatives. And I know that we will have many resources for you at the end of the talk for you to take a look at. And again, it's important, like with anything, to lead by example, especially with good mental health practices. And as a reminder, as an employer, you influence benefit coverage and design, medical, mental health, and prescription. These are all things that you can work with your insurer of choice on. You can choose vendors of health, wellness, an external EAP and disability insurance, occupational and other worksite programs, making sure it's the laws, the Disability Act, Mental Health Parity and Addiction Act, and FMLA. You can make sure that they are being implemented within your workplace. Reimbursement policy, healthcare quality, and again, stigma, I think, is an important piece that employers can influence, and they're not always taking advantage of that influence. So just to kind of wrap up, now that I know that we're continuing to open more to more normal times, a lot of the emergencies, a lot of the health emergencies seem to be dropped. People are getting vaccinated. People want to not wear their mask. Where are we right now nationally with symptoms of depression and anxiety disorders? The latest number that I could find was the end of March. I think they probably stopped doing it at the end of March. But what I do want to point out to you is this is still a significant issue for people out there. Our national estimate, if you take a look at our overall number, 35% is still ahead of normal. It's down from where it was even in December. You can take a look at that. So that's really good. I want to continue to point out our 18 and 29-year-olds. They have still a large percentage of symptoms of anxiety and depressive disorder. Again, it's down from December, but it's still very significant. And we still have the difference between whites and non-whites with the significance of these, the prevalence of these symptoms of anxiety and depressive disorder. So just as a reminder, I mean, we're in a better spot now vis-a-vis kind of everything with the pandemic, with everything that's going on and all the positive things that are going on. There's obviously still worry and there's still anxiety and depression that's happening. And I just wanted to make sure that was clear, not to be a Debbie Downer here at the end of the talk. So we'll have resources that we'll talk to you about, and here are some, and I know that we'll have that available for you. So I am actually going to be here for questions, and I'm happy to answer questions now. If you have specific things that you'd like to email me, to ask me, here's my email address, here's my phone number, and I'm happy to go further into detail that way. But that's what I have prepared. So I am happy to be here for questions. Thank you.
Yes, thank you, Dr. Halverson. So again, hello everybody. My name is Melina Cambizzi. I'm the Senior Vice President of Business Development and Strategic Marketing at the Alliance. Actually, we do have some questions for the good doctor, if you don't mind staying on for a few minutes, Dr. Halverson. Thank you, sir. So some great presentation, and thank you for the resources as well. Those are very valuable. It was interesting, well, and the numbers are staggering, absolutely staggering, 50% of the 18, what was it, 18 to 29. And then even in the productive years, those numbers are still very high at almost 30–40%. You did
what you find interesting, if you look at those numbers, what's interesting is that the elderly and the retired, which I know from the beginning, everybody's been the most concerned about that age group, and their depression, anxiety really hasn't been that high. It's really been the workforce has been really most affected by this. It's been interesting.
No, absolutely. I definitely did see that. Of course, the isolation of the elderly and the fear of potentially even death. I'm sure it was not very good for any of us. And I live in the sandwich generation. I have elderly parents and I have kids. So I can see how definitely people my age bracket feel the anxiety. An interesting point that you made, the difference between addiction and mental health. And are the symptoms the same? And I know, again, these are not issues that we are just all of a sudden are dealing with during the pandemic. How do we recognize the difference between the two? Because I think that's significant.
I think it's a really important point. The first piece that I kind of want to underline is oftentimes it's a both. It's not an either or. So that can make it more of a challenge. And one of the things as I'm going through this presentation, I understand that there's a lot of overlap between what's happening, what addiction looks like, what mood disorder looks like. I think what the biggest differentiators between addiction and mood disorder. So mood disorder is going to be kind of more of a consistent way people are over weeks or unfortunately longer, months, when these mood disorders fester and they get worse. I think what you find with addiction is there's more of an up and down. There's more of a, going the use, there's the cycle, there's use, there's withdrawal, there's trying to stop for a couple of days. There's use, there's withdrawal. So what you're going to find with a person with a mood issue, it's kind of more of a consistent. Monday is going to look like Tuesday, is going to look like Wednesday, and it's not going to be like they used to be. I think what you'll find oftentimes with substance use, and as I said, oftentimes you'll have a mood disorder underlying that, but you'll find that they'll have good days, and then they'll have days where there's bad days. Things like trips to the bathroom, or you're just not sure where they're at. That's obviously concerning for going in the bathroom and using while people are on the job, which is obviously dangerous and concerning for a lot of jobs. Things like that, not knowing where people are, that's much more common for substance use. Classically it was being late at lunch, coming back late from lunch all the time and showing back up intoxicated. Obviously, if you're showing up intoxicated, that's a much more common way to present with substance use. You can look at certain things. I think we all think we know what someone looks like when they're intoxicated. I think the opioid epidemic that we've been living through for the past 5 or 6 years, I think we're pretty good now at looking at pinpoint pupils, or if they're going through withdrawal, much larger pupils. There's obviously people behave intoxicated kind of in a different way. But I just want to kind of get back to, oftentimes you'll see both of them. So it isn't always as easy as one or the other. And oftentimes we're going to find that there are both issues happening and both need treatment. And how we would do that is, I'm sure we would look at the substance use. The substance use is a piece that would have to take primary, that you would need to get under control first. Although if you look deeper, it's oftentimes a mood disorder or an anxiety disorder that's worsening the use of that substance at that time. But once it gets going, the substance abuse really takes on a life of its own really requires specific treatment.
So that's very interesting. How do we start this conversation as employers? It isn't an easy conversation to start, right? I love your thoughts about conversations proactively, top down, culture, living exactly what it is that we are saying, absolutely. But the conversation that needs to happen from a manager to an employee or an HR representative to an employee, either in person or often still virtually,
Yep.
right? So
Yep.
how do we have that conversation, at least to start the process?
Yeah, I mean, you're right. It's an uncomfortable conversation on both sides. You know, one of the things that we're focusing on as a system, obviously we do mental health, but we have a lot of employees, and we really have focused on making sure that our managers have the tools that they need to be able to have these conversations. We spend a lot of time with them. You know, we've done emotional intelligence where we've evaluated and tried to help our managers be able to have a better understanding of meeting their employee where they're at. So it's having this conversation, but it's also kind of having any conversation. How do you have any conversation with your employee in an effective way that's not going to get them to quiet down more? You know, the best conversation to have this way is to not be able to have this conversation. If you have a culture that talks about this, possibly they have coworkers that are saying, you know, hey Jerry, you haven't been showing up. You know, we've been having to do your job for a while. You know, what's going on? We're worried about you. It really, you know, at the beginning, it's about not being able to do your job, but it's really communicating how much, you know, you're worried about them as a person, because these disorders, obviously they affect work. And if they're affecting work, they're affecting their home life, they're affecting their ability to function as a human being. And I think being able to have these conversations in a non-punitive, supportive way is important. And you know, some of us are really good at that, some of us aren't good at it. But what we've learned here is people can be trained with those skills to be able to connect better with their employees, and then those employees are more likely to take that conversation in a better way than they would otherwise. But it's an important conversation to have, and it is a difficult conversation. It's difficult for the employee, it's difficult for the manager. And again, I think whatever we can do to make sure that managers have the skills to have those conversations. As I said, we've had a lot of play acting. Our managers have watched, and again, we have a lot of our managers are social workers. You know, we have a lot of people that do this for a living, but it's very different with the employer manager employee relationship, with everything that comes along with that.
You're absolutely correct. We have one more question for you. Any recommendations on how to bring employees back to the office without adding to the pandemic anxiety? Many of our employers are manufacturing, so they have employees at work, but many of us are still working from home.
Yep.
Any recommendations on that?
Well, I can tell you what I'm sorry, I'm gonna sneeze here. Hold on. Sorry. Allergies don't bow to the pandemic. So obviously we've been working on this ourselves. I mean, even within our medical staff, you know, trying to, you know, we've utilized a lot of telemedicine. And it's been very helpful, but telemedicine isn't the same as being there with the patient, and so we've had to work on this a lot. So even, you know, when we've never been more essential than we've been during this time. We've been busier than ever, and we've had to work with our staff, bringing them in and making decisions on who comes in and who doesn't. And you know, what we've found is there's obviously a lot of anxiety surrounding this. Different parts of our country, we've had different groups that have worked together to be anxious and have trouble coming in. I think what we found was useful to start having those conversations about coming in early. And I've seen this with other employers, you know, a month ahead of time or so, at least, where you can start having these conversations. In fact, I'm having a town hall with some of our West Coast employees that we're going to start bringing in, you know, over the next few weeks, that we can answer questions. You know, I think one of the pieces that's important for us to be able to communicate to everybody else, because obviously our inpatient units, we have had to have people there. I mean, we have been in person the whole time, which is what we're here for. But our experience shows us that masks work, that PPE works. And I know people don't necessarily enjoy or want to wear masks, but masks have kept us safe in our hospital system, and that's what our county health authorities continue to ask us to do. So I think we need to continue to make sure people understand that the work environment can be safe. You know, we have polycarbonate barriers, you know, but people don't want to use them. People want to be able to be there with their patient, and masks and eye protection have been super helpful. Now we still have it. So I mean, I'm in my office without a mask because my door is closed. You know, we still are wearing masks when we're in common areas. Meetings, we're starting to have meetings with people in the room, and we're doing the distancing that we can. But I think what's important is be able to give people experience that this has been done safely. You know, obviously our community numbers now are quite low, and hopefully the likelihood of things getting a lot worse again are lower. But we also tell our employees, you know, if things get worse again, we can look at making different adjustments, but we're just making the best choices that we can based on what everybody else is doing and what's going on out there. And we do know that masks work, and masks are helpful. And even though we don't have mask mandates, masks help spread of COVID or other diseases in the workplace. So I mean, we're able to, we just really hang our hat on the fact that what we're doing seems to be helpful and seems to work. And now if you haven't had people in, that's a little bit more of a difficult story to tell, but you can certainly talk about like companies or like places. Like, we're obviously taking all comers. Some people are having COVID, some people aren't having COVID, and with our masks, we're able to make sure that there isn't that spread.
So that's fantastic. I'm not seeing other questions coming in. Thank you for your time today and hanging on here with us. It was very helpful. I know you've made your email known, so I have a feeling that some of our employers will reach out to you.
I'm more than happy to do it. This is a super important topic, and thank you for asking me to share it with you.
That's fantastic. Thank you, sir. Diana and Julie, may I ask you to join us, please?
Of course.
Good morning, ladies. So it is my pleasure to present our panelists. Diana Clark is a benefits manager with Promega Corporation, and she has had experience over 25 years to include insurance, healthcare, hospitality. She is a self-proclaimed benefits geek, and I will say that you need to be also a self-proclaimed data geek, because I know how much you use data and actionable information in strategic planning of your healthcare. So one geek to another, pleasure to call you a benefits geek. She has found her passion in benefit strategy. She embraces all of the personal relationships that come her way and that she develops by working with people during issues such as leaves, absences, caregiving situations, etc. I've been personally working with Diana for the past 3.5, 4 years. And so it's a pleasure to have you here, Diana. I also would like to introduce Julie Norland, who's a human resources manager with MRA. I've also had the pleasure to work with Julie for as long as I've been at the Alliance. So welcome, Julie, as well. With more than 20 years of progressive human resource experience, Julie has worked in the distribution, manufacturing, service, and healthcare environments. She works as a business partner and a collaborator to help employers increase their organizational effectiveness. Julie coaches and advises managers and senior leaders of organizations on complex employee relation issues, and is also a certified SHRM senior professional. So again, Diana and Julie, thank you for joining us today. We've asked attendees to send us questions ahead of time. We've had some of our own questions as we've had discussions. So I'm going to start with the very first one. And we'll talk a little bit about the pandemic initially, but this issue of behavioral health, mental health issues, definitely much broader than just the COVID pandemic. So, but we do know that the pandemic has had a profound effect on our and our employees' mental health. What are some of the best practices you all have had to implement this year? And are you doing anything outside the box that other companies can adopt? I will start with Diana and then ask Julie if that's okay.
Sure, absolutely. Happy to be here with all of you today. Some of the things that we have been focusing on at Promega, utilizing our established resources and then also trying to pivot to include new benefits and opportunities for employees. We had on-site counseling established prior to the pandemic, but saw a steep increase in the need and desire to connect with our counselors. So we were able to add some resources there and bring on another counselor to help support the increased workload there. We have an established program with emotional social intelligence training, and we shifted some of those teaching opportunities to really encourage people to focus on mindfulness and meditation, the fact that it's the little things, a few minutes a day, and how we look at things, or starting your day with thinking of something to be grateful can help set you in the right mindset and push forward through that day. We shifted our fitness initiatives to be virtual so that our employees would continue focusing on their physical well-being and have that outlet during this time when our on-site facilities were closed and many community resources were closed. We utilized Yammer for interpersonal social communication within the population to really keep us connected, keep conversations going, help people find each other during this time. And then a couple of the things that we did specifically related to the pandemic included our screening team that we put together to handle any employees calling in sick. Normally, we wouldn't be asking a lot of questions. We were trying to respect people's privacy. But when it comes to something potentially contagious and having 600 employees still on site, we needed to find a way to employ the right people to engage with them and ask questions to ensure that we're keeping our on-site population safe.
Julie?
Yes, thank you. It's a pleasure to be with everyone this morning. And, you know, while I think much of what I share wouldn't necessarily be considered outside the box, I think one of the things that many employers have done that's been very successful is to be extra flexible and extra accommodating with employees during the pandemic. And sometimes that message needs to be repeated frequently and often, is that employers might worry, like, well, are they really going to allow this flexibility, or is it going to be held against me down the road? And I think that reassurance that, hey, we really do want to support our employees goes a long way. Other things would be to just remind people about the employee assistance programs, and how to use their mental health benefits and how to figure out what mental health providers are available. Again, this might be the first time that some employees have accessed those benefits, and it may be different than, well, I call my clinic. So reminding people how to determine which providers are in network can be important. I think we've also really had to rely upon our supervisors and encourage them to be checking in with employees, and that goes a long way as well. And that, hey, it's not just about talking about work, asking about how things are going at home really supports employees. And then some of the things that I think Diana mentioned around just general wellness, being physically active, encouraging employees to get regular sleep, healthy eating, and unplugging sometimes from distressing media can go a long way.
So Julie, I'm going to stay with you for a little while because you serve as the HR manager here for the Alliance as well. And I do know that during this past year plus, you've been calling all of us on a regular basis. I think it's once every couple weeks that you do the rounds. We're not a very large company, but you do work with other smaller size employers. And sometimes it is, you know, maybe smaller size employers don't have all the resources that somebody as big as Promega might have. Any thoughts about that? I've personally appreciated the phone call to say, are you well? Are you okay? So talk to us a little bit about how smaller employers are dealing with some of these issues.
Sure. And you're right, Melina, is that many times smaller employers don't have the resources that a company with several hundred employees has available to them. But many of them do have an employee assistance program. And again, I think employees forget about that program because it is not a benefit they need to sign up for. They don't need to enroll, and they forget that it's available. And so as Dr. Halverson indicated, I think frequent reminders to employees that that's a benefit that is available goes a long way. And so putting that in employee newsletters, I know at the Alliance, sometime in the last quarter, we did as an employee staff meeting, we did a reminder about those benefits. And it was nice to see members of the leadership team talk about different ways that the EAP program had helped members of their family. So again, that helps in reducing the stigma as well. I think some of the behavioral health issues may benefit from people being away from work. And so whether it's stress or anxiety, employees sometimes feel that it's difficult to unplug. And so we need to remember employees or remind employees, I should say, that they have paid time off benefits and that it is okay to use them. That is something I've really seen this year as I've talked to many different employers, is that employees have not used their paid time off benefits. I facilitated a roundtable of HR leaders recently, and many of those participants had personally not used PTO in the last year. And so we need to encourage employees to take time for themselves. And then I think on that same notion of paid time off, we need to re-educate employees about the benefits that were available to them under the Families First Act in terms of paid time off. And again, not every employer voluntarily decided to continue those, but if you have, reminding employees those still exist and that there is some financial cushion if they need to take absences related to COVID.
Yeah, and on that note, Diana, did you have to change your benefits, your covered benefits during this period, this very difficult period of time? Hang on a second, Diana. Guys, I think Diana is muted. Can you please?
Sorry about that. Thank you. We did change our benefits during this time. We had previously offered telehealth through Teladoc, and we continued to remind our employees that that option was available. Many of them had never used it before because they had a relationship with an established local physician, but many of them didn't immediately offer telemedicine services, and yet employees had this hesitation to be in person, especially if we were talking urgent care type needs. They were afraid that that's where people with COVID are going. They don't want to be sitting in the waiting room of urgent care. So reminding our employees that they could use the established Teladoc. And then we also took the time to work with our local providers and our plan document to update coverage for those providers locally who were now offering telemedicine, who didn't offer that previously, and updating our actual benefits coverage to ensure that our employees could access appointments and treatments with their existing providers through this new mode.
Yes, thank you. And I do believe that you and I have had some conversations about, I'm going to go there, right? I will. We've had some conversations regarding facility fees that some providers are charging for telemedicine, not just behavioral health, but telemedicine in general. If I recall correctly, you had to update. You wanted to have this covered for your employees as well, so you updated your SPDs to reflect that too, right?
Absolutely. We always included facility fees as covered services in our plan document, but more than anything, the shift was to educating employees. The assumption was that facility fees wouldn't apply with telemedicine because you're not setting foot in a facility. And we had to ensure that first that we understood whether they were still being applied, which they are, even with telemedicine appointments, and helping explain to employee that the thought process behind that is it's the software investment, it's the other infrastructure that's still supporting those types of appointments, and that facility fees still do apply for providers in the area.
And also, I know in previous conversations you talked a bit about text counseling as well. I was very interested in that because I hadn't seen it before. Can you talk a little bit about that?
Absolutely. This was a new service that our employee assistance program provider rolled out in 2021 or late 2020 through Health Advocate, which is our vendor for EAP services. They began offering text counseling, and they call it My Help. They had been offering phone and video counseling previously, but began offering this new mode of communication and acknowledging that certainly, you know, like with emails versus a personal conversation, there's some communication that can be lost in translation when you're typing. On the other hand, when you talk with our younger employees, this is the primary way they communicate with each other, is texting back and forth. It's what they're comfortable with. And when we start talking about situations in which they feel very vulnerable, anxiety and depression being perfect examples, we really needed an opportunity to meet them where they were and have them, provide them with the opportunity to communicate in a way that they were comfortable with. You know, if it's a social disorder that they're struggling with, sometimes just the cadence of a personal conversation can be stressful because they're worried about filling the silences and answering in an appropriate time. Whereas with text counseling gives them the opportunity to stop, think about the question, process their answer, and type back when they're ready. So it's also worked well for some of our new parents who maybe have a colicky baby at home and you can't hear it to be on the phone with a counselor. And so text counseling can be a nice solution for that as well.
Yes, I was very interested when you presented it to us. I know both the Alliance and Julie, in your experience with other employers, but also Promega, you've done a lot to support people at home during this pandemic. I know Diana talked a little bit about the virtual fitness classes, etc. What are some other things that you've seen employers to have done supporting people at home? And mind you, there's still a lot of employers that still have a lot of people at home. Julie, can I start with you and then go to Diana?
Sure. Well, I think a lot of it has been around flexibility around schedules, especially with employees who may have caregiving responsibilities or have children who are doing homeschooling. And if the work allows for flexibility, being flexible with those schedules. Other things have been more around collaboration and relationship building. Again, an example from the Alliance, members of not just the leadership, but any employee really who wants to lead either a coffee hour or social hour. They're really, sometimes there's a fun agenda. I know one that was super popular was sharing the best gift that you ever received or were given. That people really enjoyed that when people were talking about meaningful gifts they've received. And it kind of, to a point Diana made earlier around gratefulness, it was meaningful for people to hear about things that they were grateful for in their lives. Or fun things like scavenger hunts during those social hours. But then some of them really have no agenda, and it is purely an opportunity to build relationship with your peers. Employers who are working remote, that people are missing the opportunity to build relationships that sometimes they would just have when they were getting a cup of coffee or crossing paths in the hallway, and people miss that. So those are some of a couple of the things that I think employers have been doing.
And Diana, I know during the quarantine, you folks were delivering grocery items to employees and other great things. You want to talk to us a little bit about that?
Absolutely. To start with that particular example, one of the things that we recognized early on when we were utilizing our screening team and asking people to quarantine when they called in sick and they had certain types of, whether it be exposure or symptoms that we were concerned about, is we recognized that we were asking them immediately to start a 14-day quarantine, and the person may not be equipped to do that. They may be living by themselves, they may not have family in the area. And so when you look at what right now, if somebody asked you to stay home for 14 days, what do you have in your refrigerator? What do you have in your cabinets? Do you have ibuprofen if you're not feeling well? Do you even have a thermometer to take your temperature to monitor yourself while you're sick? And we're hearing these things from our employees as we discussed starting the quarantine with them. We're fortunate to have a group of volunteers within our organization that's over 180 people strong now, called Circle of Caring, that really just rallies whenever we have these types of needs. And so we utilize the group. Sometimes we were stopping somewhere to pick up a thermometer and drop it off at someone's doorstep, or cough drops, or groceries, or other household needs that they may have to quarantine during that 14 days. One of the other types of things that we were doing is focusing on, now that we're asking people to work at home, how are we supporting that immediate change? We have an ergonomic specialist that we encourage people to reach out to. Say, if you're working at your kitchen table and you're sitting on a dining room chair, or you're hovering on a stool, and you start having lower back pain, or before you start having lower back pain, please engage to make sure that we get you set up properly. This is not a 2-week situation we're in. We want to make sure that you have the things that you need at home. Helping them find local childcare when the situation started shifting and many of our centers were closing. People that normally had kids at school and now we're virtually learning and yet trying to work full time or be at work, understanding what options were available for those kids. We actually set up, we worked with a local educational organization to set up what we call ideation, Agora Ideation. It's a camp right at Promega. And people can utilize it like a daycare. It supports the virtual learning. We provide food, they get outdoor activities, and that was available. And then we offered a subsidy to those employees that needed to use that.
Yeah, sorry, please go ahead. I'll tell my next.
Sure, sorry to interrupt, but we've kind of focused our comments, I think, often on the employees who are working remote. And there are a lot of essential workers as well, and we need to remember that they have some issues as well. So they may have found it challenging. Their daycare provider may have closed down at some point, or it's just the appreciation and acknowledgement that they are essential workers, and that many employers have found ways to just acknowledge and thank them for coming to work each day, whether that's through social distance, box lunches, small gifts, and that those types of things can't be forgotten even when the pandemic is into its second year. And I'm sure Diana has experiences in that area as well.
Absolutely. That was something that with the 600 approximately people that were remaining on site, one of our primary concerns was, how do we assure them that they're going to be safe coming into work? And how do we make it convenient for them to still be coming into work? Many of the local food establishments had closed down, and so our own culinary team, even though we were no longer hosting a typical cafeteria, what worked well for us as a win-win was we kept that culinary team busy producing food, but then we provided it at no cost to our on-site employee with those prepackaged individual foods. And working with the operational managers to add in those additional thank yous and appreciation, and acknowledging and communicating what we're doing to keep each other safe, talking about the mask requirements, marking out social distancing on the floor when it comes to where the break rooms, how far apart we sit, discussing how we're handling when an employee calls in sick and why we're keeping them out for the period that we are, so that the employees on site can feel confident that when an employee comes back from an absence like that, they're not coming back contagious.
So Diana, I actually, the first question, we got a couple questions as we've been chatting. I believe, Diana, you said your EAP provider is Health Advocate? And
Correct.
Would you, yes, and would you be willing to give out information if somebody's reaching out to us for that information?
Most definitely. We are in our 3rd year of partnership with Health Advocate, and we have just been floored by the increase in utilization of our EAP programming since we shifted to this model.
Yes. Then also there is a question, I believe, to both of you. I'm going to read it. That's why I'm looking up, because I don't want to miss the point of the question. So this person, this audience member says, our organization decided to continue to provide the Families First Coronavirus Response Act benefits for this year, I assume 2021. Leaders are getting anxious to discontinue these paid benefits, concerned that some employees are taking advantage of or abusing this opportunity. What are some things that employers should be considering or weighing when deciding to continue or discontinue the additional paid time off relating to COVID concerns? Diana, may I start with you?
I would say it might be better to start with Julie. This only applies to a small portion of our population. A bulk of our organization isn't eligible for that particular benefit.
Okay, thank you. Julie,
Sure.
any?
Yeah, well, I think there needs to be some consideration about, is that worry from managers a legitimate worry? And if so, from what percentage of the population? I think sometimes, and I don't want to diminish the worry, but if it's 5% of the employees or fewer that are causing the issue, there are ways to address that small number of employees, and you will do a lot to build and enhance and retain employees to trust the 95+% versus that small number. And I get that could be viewed as a Pollyannish response, but I also think it's important. The other piece of, or an additional piece to consider is how comfortable does your workforce seem to be with getting vaccinated? And if that is a smaller number, if you feel that percentage is low, you could continue to have COVID illnesses in the workplace for months to come. And so that need for employees to miss work because they are ill is likely going to be higher. Then I think there's also just the financial consideration of both from a productivity perspective. Can you have people be away from work and get the work done? But if they are, and you have a reimbursement option through the government, as an employer, it's important that we not forget that, yes, we are paying this benefit out to employees, but we are being reimbursed at the back end. If the person who submitted the question has, a particular nuance that they'd like us to address, I'd be happy to do that.
Yes, absolutely. And I'm not certain who asked the question, but audience, if you would like to address this more, you can absolutely write to us and we can connect you with Julie. I totally agree. As a manager and a leader, totally agree with you, always looking at the bigger picture. If the numbers are small, then that's an indication. If, on the other hand, the numbers are big, then it's a different strategic discussion to be had. I would like us, so now we're shifting to bringing employees back to work. And I do know, Diana, in your company, a lot of your employees are at work because you're an essential operation. You're producing many of the COVID testing materials, right, or components. But you also have 100+ employees that work from home. How are you considering this move now back, if you are, this move back to the campus?
Yeah, absolutely. It's been a large topic of conversation over the last few months for us. One of the first things that we we're sure to communicate with our employee population that is currently working remotely is that the situation, that the arrangements that they currently have in place, assuring parents with children that that will stay in place through the end of the school year. So we're not going to rip the Band-Aid. We're not going to tell you next week that what needs to happen, but helping provide those assurances for parents who have had such a shifting landscape under their feet during this entire pandemic, that what you have in place will stay in place until the children are shifting to more of a summer mechanism. That also made sense for the rest of the population for us to take time to evaluate what's been going well with our employees' telework options and what the employees' needs are. We are launching a company-wide survey and focusing on, for the employees who are working remotely, asking them, what is going well? What do you like? What are your preferences? If we could give you a choice, would you stay at home? Would you use a hybrid work situation, or would you be back on campus? And we're actually utilizing the results of that information to look at repurposing the way we use our space on campus, because we believe there's going to be a large portion of our population that we will now be enabling to work in a fully remote or a hybrid situation. You know, we've been able to talk about with the supervisors and managers about productivity and some of the pleasant surprises that have occurred, you know, having everyone work at home. Productivity actually is not something that we've sacrificed during this time. And for many people, it actually increased because you don't have the social distractions or the drop-in things or the time between meetings. It's really, there've been some very positive gains. So we're starting by asking the employees, and then we'll be working together as leadership teams to look at what we can do to not only meet the employees' needs, but then continue our productivity as an employer and the collaboration that we need.
Julie?
Sure. So I think planning early is key, which again kind of reemphasizes what Dr. Halverson indicated. But that early planning helps the organization figure out what questions and concerns employees and supervisors have, and then the organization can plan to address those. I think that also then ensures that you are able to give employees adequate time to prepare and adjust to return to the office. They are going to be worried about logistics, safety. They may be worried about equipment issues, and I think the organization needs to plan for that of, okay, if we do go to a hybrid model, as an organization, do we need to purchase different equipment so that they have equipment at home or at the office, or is it flexible enough to work in both? They may also need to modify their childcare arrangement. So again, if you can allow at least a month to let people know that the organization is returning to the office, or at least in a hybrid model, and when that will be, so that employees have time. You know, I think everyone does better with change when we have time to get ready for the change versus being informed on a Tuesday that in 6 days they're expected to be back in the workplace.
Yeah, so here my joke before was that I'm in the boardroom that used to have 20 some chairs. There's 5 chairs right now. So the Alliance is devoid of chairs. We all came in and took chairs back home. So if we have to come back, we have to have a caravan bringing the chairs back. But sorry, Julie, you had something else to add as well.
Right, and I was just going to add in about the essential workers who have been in the workplace at all. I think we mentioned earlier, but especially as we bring more and more people back to the office, reminding everyone about the safety protocols that are in place, and making sure that, you know, sometimes perhaps, especially as people have gotten comfortable with coworkers, or maybe they know that the person who works nearest to them have been vaccinated, that maybe they're lax about some of their safety protocols, and reminding them that masks work, and using and washing your hands often, and all of those things that are common sense, that those things will work, and that the organization is going to enforce those safety protocols.
So we talked a lot about COVID. We've spent almost an hour and a half talking about COVID. And unfortunately, this past year, 2020, hopefully not 2021, but this past year was unprecedented. We had political issues and differences that we were dealing with. We had violence. So violence, I've been reading the statistics, violence sort of was less during the pandemic, but now it's picking up again, which is very disturbing. Of course, we had racial disturbances, racial issues, and of course, isolation and other societal issues. Any last words of wisdom, any suggestions of how to take care of our employees? I believe I'm hearing that some of these issues will be going on. I mean, even if COVID is not the issue anymore, we're still in a society with multiple challenges. Any last suggestions of how do we take care of our employees? Julie, I'm going to start with you. I'm sorry, I'm looking at you like you can see me, and yeah, I'm looking, you can see. No, so Julie, can I start with you?
Sure. Most of what we discussed already in regards to addressing and encouraging healthy behavioral health issues will apply to politics and issues of social justice. But in addition, many employers are taking time to re-emphasize their respectful workplace policies and re-educating people on those policies. But I also think that checking in with employees who are people of color, especially when there has been an issue that has flared up in the media, when I have done that, that has been really appreciated. That just the recognition that they may be feeling differently because of violence against someone in their community. Again, that has been really appreciated when I have reached out to employees in that situation. And I think many employers now have reprioritized their diversity, equity, and inclusion work. And I think that's healthy. And I think employees who are impacted, which we all are, find that to be healthy for the organization as well. Diana?
Absolutely. The stressors in the last year have certainly been plentiful, and I appreciate the attention on employees' mental health and well-being. I think that the pandemic is, as you said, just simply one of the stressors that people have experienced. And what we really have taken the opportunity to continue focusing on at our organization is connection and collaboration. Providing people with safe spaces to have a conversation about a difficult topic, starting some group work around diversity initiatives that people may have a specific interest in, bringing people together that want to talk and ask questions and have a truly that safe space to connect and discuss in an open format as we explore our diversity initiatives. You know, we've really been boosting the opportunities that we've provided internally, but along with that goes the need to acknowledge that in the Midwest, we are a more homogeneous environment than than other areas of the country may be. And so then acknowledging our own blind spots and being able to have these conversations and say, you know, I don't want to put it on my one gay friend to be the person who I ask all questions. It's not their job to educate me about these things. So instead, can we get together? Can we find good resources? Can we read books? Can we have conversations? Can we listen to podcasts and webinars and create a safe space where I might not always use the right terminology, but I'm learning and I'm asking and I'm discussing these things. And that type of connectedness is truly key. In any community, but truly during a time when we're all under so much stress.
So I want to thank you very much for helping us tackle a very, very difficult topic, but also a very important topic for all of us. And I know we've been hearing from our employers here at the Alliance that this is important to them. So I know we're going to have more conversations in the months to come. So I want to thank you both very much, Julie and Diana. I also want to thank Dr. Halverson and my colleague, Kyle Monroe. Please, to the audience, please remember to download the resources from today's webinar. They're available in the Go Webinar control panel. Please also, just a little remembrance, May 6th is our spring symposium, and our keynote speaker is Dr. McCary, and I know many of you are excited. Many of us have listened to him multiple times, but we're always excited to have him. So from 9 to 11:30 on May 6th, our spring symposium. I think you're gonna see me and the team again. So once again, thank you for the privilege of your time today. Thank you for your knowledge and the important work that you're all doing. Have a wonderful day, everybody.